Well, hello everyone. I'm Dr. Andrew Sharman, President of IOSH. I'm delighted to be your host today, and I'd like to thank you all for joining us on this webinar. So let's get moving. Thanks once again for joining us today. I just wanted to spend a few minutes addressing you all as your president with a note of support as we try to cope as well as we can through this unprecedented challenge that we know as the pandemic. Covid-19, the coronavirus has and still is continuing to disrupt our lives. We're having to isolate ourselves, distance ourselves from family and friends, and work in different ways, not being able to engage or interact in the ways that we used to. And it's quite unsettling, isn't it? On a personal level, I found myself in exactly that situation. I took a quick 4-day trip to visit my family in Scotland, which turned into 3 months being away from home, with just a weekend bag of clothes. I was locked down in rural Scotland away from home and fed up out of living out of a suitcase in an Airbnb rental apartment and not being able to go and see my family and my friends. I also managed to contract the coronavirus and had several weeks of not feeling particularly well. And still, several weeks later, I have some unpleasant symptoms which the doctors tell me will stick around for another couple of weeks yet. In trying to get home to Switzerland, I originally had a flight booked for the 19th of May, but that was cancelled, and then the second flight cancelled, and then the third flight cancelled too. I eventually managed to get back here to Switzerland just a couple of days ago, and I'm grateful to be back in my own bed with a choice of clothes, and it's lovely to be back in a place that feels familiar. Like many of us though, I've had enough of this pandemic. The cabin fever of it all is settling in. The precautions that we all need to take every time we step outside our own homes is and will be challenging for some time yet. But I think all we can do is be patient, which, as those of you who know me, doesn't come easily to me. I'd like to get things done and make progress. But despite all said, we must take away the positives, embracing the time that we have to spend with those we love and finding ways to strengthen connections with others through webinars like this or through video chats, phone calls, letters, social media, and instant chat messaging. Over the last 3 months, I've found myself writing handwritten notes and letters to people that I realized that I probably have lost a bit of touch with, but they're still important to me in my life. So I just wanted to reach out and say hello to them. And of course, there's the constant news feeds on the pandemic too, isn't there? They're hard to avoid, aren't they? As the coronavirus dominates every newspaper, news feed, and news reports. But what I've noted for myself over the last three months is that there needs to be a balance, doesn't there? We can get too much news, and I think one of the biggest risks from this pandemic is the infodemic that accompanies it. So I'm trying hard not to watch news at the moment and instead take my updates from the scientific communities just once per week. I guess we're all finding our own ways to cope and to understand what the pandemic means for us. And what our role is too, whether it's as a husband, partner, wife, brother, sister, father, mother, friend, colleague, co-worker, or other. One of the things that I've learned most importantly from this pandemic period is the importance of human connection. Whilst governments around the world are advocating physical distance between people, I think what that physical distance does is, whilst it separates us, it closes us in terms of the social connection and increases the amount of human connection that we can have. Whilst we may be separated physically, I'm hearing so many stories of the ways that you're reaching out to important people in your lives, whether they're friends, families, or co-workers. And I think this social distance is actually reducing thanks to technology and traditional ways too, like making phone calls or writing letters. One thing that's really important to me as your president is the work that you do. It's never been more important than right now that the profession has an opportunity to come right to the fore in this pandemic. At the end of March, I recorded a short video message for all of you as IOSH professionals. It's been dubbed my co-video. I did another one just at the beginning of June, about a week or so ago. You may have seen them. I'm speaking in both about the amazing efforts of IOSH professionals around the world IOSH members, of course, nearly 48,000 of us, but others working in keeping communities healthy and safe. What I know from talking with branches and groups and teams of IOSH members around the world is that many of us are either working from home with families and kids around, or from makeshift desks on our dining tables, in our sheds or spare rooms, or in accommodation where we're not meant to be, like the rental apartment I've been in for the last 3 months, or other members who are stuck in hotels in countries that are not their own. And then, of course, there are those of us who are working in different displaced or unusual work environments too, as we try to get our businesses returning to work safely. Regardless of where we are, one thing for sure is that we're all joining forces as one to ensure that we and our membership remain strong. And for me, it's a real pride and honor right now to be your president, particularly in these turbulent times during the pandemic. So if you haven't already seen those co-videos that I've recorded, you can see them on the IOSH Coronavirus Resources page. And please feel free to share links to them in your own networks too, so that everyone that's working for the health and safety of people around the world benefit from these messages of strength and support that I'm trying to share. In those videos, I also spoke about the IOSH Benevolent Fund. Have you heard of it? Many of our members may be facing hardships during this challenging time, and that's where the Benevolent Fund could offer a lifeline of financial or other support to members who are struggling. I encourage you to take advantage of the Benevolent Fund if you find yourself in that situation right now, or if you know someone that might be able to use a little bit of extra help. To find out more, just visit iosh.com/benevolent fund. To show our support, every member of the IOSH presidential team has donated to this vital fund. And we'd appreciate your donation too, no matter how small. Every pound, dollar, and cent can help one of our members somewhere. So if you're able to do so, please consider boosting this fund to help your fellow colleagues and members. You can donate in just 2 or 3 minutes, very quickly. iosh.com/how-to-donate. I've mentioned my personal situation and having felt anxious over 3 months of being stuck in an Airbnb rental apartment, away from the country that I normally live in, away from my home, my friends and family. And I think it goes without saying that we'll all be feeling somewhat anxious by the changes that we're experiencing over the last few months, and for the future too. So to address this, I'll soon be handing over to Eldridge and Jonathan Hughes, both Vice Presidents in our presidential team, who will present a session on how our mental and physical well-being can be affected in these difficult times, and how to mitigate those effects. I really hope that you'll each take something away from that session with Tim and John today. IOSH members are critical to a safe and healthy recovery from times of crisis and occupational risk, just like this. It's vital that our membership is supported, and the presidential team are very proud of efforts dedicated to doing this. So far, we've taken the presentation that John and Tim will share with you to more than 700 members across our networks, and still have a number of branch and group events scheduled for the next few weeks. Another 437 of you today go through this session. And you can find these resources on the coronavirus page too, and continue to share them in your networks. But in closing, during these difficult times, it's important to remember that the little things we do often make the biggest difference. Looking out for one another, our loved ones, our friends, our neighbours. Recognizing and thanking those that are working throughout this period. Whether it's the key workers, those on the front line, or your colleagues at work as they try to find ways to return to work safely with the anxieties that they bring with them about whether they're safe or at risk from the coronavirus back in their normal workplace. A phone call, a letter, a video call, a quick check-in with someone at an appropriate physical distance. Whatever we can do to stay connected. We're all on this journey together. And I absolutely believe as one IOSH, we will succeed this virus. I'm sharing my personal journey each week in my LinkedIn posts that I'm calling The Life of the IOSH President. And I encourage you to get involved in the discussions there. Each week we have several thousand people viewing and commenting on those posts and sharing their experiences. I'd love each of you to come and join, and I'll post a link in the chat box on this webinar on how you can find those sessions. IOSH will, of course, continue to keep you updated and support you throughout this challenging period. So keep an eye on the IOSH website, in particular, the coronavirus page, where there's a number of resources updated on an almost daily basis, including the replay and the resources that we're sharing in this webinar with you today. As I said earlier, right now is the moment that our profession can really shine. Our profession has never been more needed and never been more important, in my view. We'll look back at this moment in years to come and we'll say, hey, that's when things really changed. That's when we were recognized. That's when we as a profession were really valued. Thank you for your time. I wish you and your loved ones the very best. Take care. Don't forget to make time for yourself and your own well-being too. Stay safe. I'll now take a couple of questions from you and then hand you over to Tim and Jonathan.
Thanks, Andrew, for that great introduction speech. And just to remind everyone, we do have the Q&A tab on your webinar where you can ask Andrew some questions now or use the chat function. So if you do have any questions for Andrew, please post them in. While we're waiting, Andrew, perhaps one thing I might ask you just to make a quick comment on. I believe that the council elections are currently live. Is there anything you'd like to remind our panel, our group today about those?
Yeah, thanks for the nudge there, Tim, and also from my friend Kieran Delaney, who is a council member and joining this webinar, as he has done many webinars over the last few weeks. Good to see you here. Thanks, Kieran. Yeah, look, council elections, it's a brilliant opportunity for members to engage and really play a part in our strategic aims in Work 2022 for the next couple of years and beyond. And really the role of council, as you know, Tim, very well, as Kieran does too, is to be the voice of members, to transmit from those 48,000 people the views of members to the chair of council. And perhaps not a lot of people realise that the president actually has two roles, two hats. I'm president of IOSH in this term, but I'm also chairman of council. Two different roles, quite distinct. But the idea of chair of council is taking all of the views from the council representatives that have come from members and then sharing those with the executive team, the board of trustees, and the senior executive under our chief exec, Bev Messenger. So now's a great time. If you're thinking about looking to how you could shape the future of our profession, applying to join council and being a voice of the membership could be a great one to go for.
Thanks, Andrew. I think we've got some questions coming in. I've got one from John, who asks that, given your personal circumstances, which you shared for us, he asks, did you ever consider flaunting the lockdown rules, given though that others, perhaps in some government circles, did? And what would be your message to those in power who flaunted and still do the rules?
Oh goodness, John Batty, what a great question. I've been living in Switzerland for 10 years now, although I'm originally from Scotland. And every time I've gone back to my homeland or anywhere in the UK, one of my treats has been to buy a broadsheet newspaper, whether through the week or the weekend, and look at what's been going on. Of course, I've had plenty chance to have newspapers delivered and read online whilst I've been in the UK. And I've been ashamed at seeing that the leaders in the UK have been flaunting rules, testing that people's cars work by driving for a long period. I guess I'm going to answer the question that John asks really with a piece of advice that I had from a CEO, one of our client corporations. I run a consulting business normally outside of the pandemic. One of our client companies, a large multinational, I was in conversation with the CEO the other day and I said, what have you learned about the pandemic? And he said, what I've learned about the pandemic right now is that leaders will be judged not by their bottom line results, but by their behaviors. And I think this is important for us all to note. So as president of the world's biggest organization for safety and health, yes, was I tempted to flaunt the rules and do something different? Of course, temptation exists for all of us. But I'm caught with this sense of personal ethic that I need to make sure I follow the rules to demonstrate the right behavior to others. So when I left the house each week to go buy groceries, I was trying to look after two elderly neighbours, one in their 80s, one in their 90s, as well as my father, who's elderly and lives alone. So I went out wearing gloves and mask, and went with a list of things that I needed to get. I took all of the precautions, remained at physical distance, and did that once a week. That was my only activity during the lockdown, with the exception of my 1 hour period to get out and take some exercise each day. I think we're all prone to temptation, but we've got to make the right choices and demonstrate the leadership we want others to have. There's a lot of questions coming in now, boys, isn't there?
Yeah, thanks very much, Andrew. So another question here on the Q&A tab from Jackie. And Jackie asks, how do you see IOSH training being delivered in the future? And if digital platforms are going to be the intended way ahead, how effective do you think it'll be?
That's a good one, isn't it? I guess we've all had to get used to technology over the last 3 months. IOSH is pushing towards helping existing trainers transition to an online platform. I don't have any intel as to how that's going, but I can offer a perspective if I take my IOSH president hat off. I run a safety consulting business, and we specialize in leadership and safety culture. We offer an online program called the IOSH Certificate in Behavioral Safety Leadership. And what I've noticed is that's really ramped up in terms of its popularity over the last 3 months. So I think that we're getting more used to online technology, knowing that we need to spend more time online. And I know that the team at IOSH, back at the Grange and in remote working status at the moment, are really working hard to make as much stuff available online as possible. So I think we're going to see more and more and more of that.
Yeah, agreed. Thanks, Andrew.
Yeah, so I'm just scrolling through a few more questions. This is great. They're all coming in. Richard asks, there's a lot of new information and a lot of us are making the best decisions we can based on limited experience. Andrew, how well do you think we as IOSH are sharing these new experiences and helping each other, and where could we improve?
I think we've been sharing more than ever. I mentioned earlier that I'm spending a lot of time on these online sessions. As Bert Brown mentioned, he saw me yesterday on the South African IOSH webinar where we had 360 people joining us there. Just a few days before, I was in Qatar with 400 or 500 people. I think we're doing more and more of this online stuff, and the idea is that we use these webinars every week to really share more ideas, and we're loading up the IOSH webpage with more and more too. So I think there's an opportunity for us all to think about what we can offer as individuals into our networks and into the broader One IOSH pot.
Thanks. Perhaps one more, John, do you think? And then we'll move into the main presentation.
Yeah, thanks, Tim. Question just come through here. Says, greetings to Andrew from Burnt. A question for the future already. If there comes a vaccine, the national health institutions will focus on health workers, teachers, public sector, high-risk people. Can you envisage a new growing importance of occupational health in a national pandemic plan and vaccination campaign?
Hello, Burnt. Good to see you here. Thanks for joining us. Yeah, it's difficult to know what the future brings, isn't it? But I think you're right that there will be a focus on health workers, teachers, public sector and high-risk people. Can I see a growing importance for occupational health in a national pandemic plan and vaccination campaigns? Yes, absolutely. And in fact, more broader than that, I think what the pandemic offers for OSH practitioners is an opportunity for us to stand up and demonstrate that we can talk knowledgeably about health issues. Now, for a long time, the H in H&S has been quite quiet, hasn't it? As most OSH practitioners have tended to focus towards safety, the technical aspects of the role. And many OSH practitioners that I know have said to me, well, I'm not a nurse or a clinician, so I can't really get too much into the health stuff. But I think one of the challenges here is that we have an opportunity to take the information from different streams, including the WHO, the UN, and the ILO, where we have them in our webinars each Thursday, and then translate that into meaningful advice for our businesses. So I think it's not just national pandemic plans, vaccination campaigns, but I think it's OSH practitioners too. So I know we're running out of time and we've got lots more things to do. So I'm just going to point to a couple of comments that have come in and then I'll take my leave. Thank you to everybody who's noticed that, yes, Tim, John and I did get the same memo, that check shirts were the way forward today. In fact, I arrived on the call just before we began and noticed and went off to change quickly and then realized I didn't have enough time. So clearly there's a preference for check shirts, and I'm glad that it's made a few of you smile there. A couple of you have mentioned that you're on furlough or you've lost your job as a result of the pandemic. Please do have a look at the IOSH Benevolent Fund. The scope for application is very broad and it's very simple to make an application. So if you're looking for a bit of extra support at the moment, or you know someone that might benefit from a bit of extra support, whether that's financial or other support, please do check it out, iosh.com/benevolent fund. And I'm certain that in the session that follows with Tim and John now, you're going to find some new ways of thinking about your own mental and physical well-being, as well as getting a sense for what's happening amongst your peers around the world too, as John and Tim take you through that session. So I'll take my leave here. I'll post a link to the LinkedIn posts, The Life of the IOSH President. I invite you all to come and get involved in those discussions each week. And I wish you all well, a great end to today, to this week, and a wonderful weekend ahead. For now, let me introduce you to Tim Eldridge, Vice President, and Jonathan Hughes, Vice President, to take you through this great presentation, COVID-19, Mitigating the Effects, Thinking About Your Physical and Mental Health. Thank you all for your time today. Thank you for joining us. I look forward to seeing you again and hearing from you in the near future. Goodbye.
Thanks very much, Andrew, and really appreciate the time you spent with us today. So welcome everyone, and it is great to have you all here, and it's really good that we're able to share some of our thoughts around physical and mental well-being during this time. This particular presentation is one that we've developed as a presidential team, quite unusually, but we recognise that we, like everyone, are very much familiar with the challenges that are being faced during this time. I myself, I'm sure, like many of you, have been deeply involved in dealing with the virus and the pandemic over the last few months. In fact, I remember, I think it was right at the beginning of January, when I had a call from someone in my organisation from Wuhan in China, who said to me, Tim, I think we've got something strange happening over here. Little did I know back then in January quite what that strange thing would pan out to be. And of course, it's now touched every single one of us in our lives. So thinking we've been managing it very much from an IOSH profession point of view, and supporting all the organisations we work for, or our colleagues and others around the world. But one of the things we really wanted to focus on today is a presentation that hopefully will raise the awareness of the important issues relating to physical and mental well-being during this pandemic. And what we would like to do is provide you as members with just some basic information to enable you to protect yourselves, of course, your families, and also those you work with. So by the end of today and of this session, we hope we'll be able to give you a bit of an idea of the negative spiral of psychosocial issues that this pandemic could well create, or already is in some cases, and when to be able to reach out and how for psychological or social support. So we're going to cover the following topics. We're going to look at the stages of prevention, which I'm sure you'll all be familiar with. We're going to look at 3 variables that determine stress. We're going to look at how the pandemic and coronavirus fits into that, looking at the negative spiral of multiple psychosocial issues and breaking that chain of causation. So hopefully in the next half an hour, we'll give you a bit of an idea of where we think some of the focus should lie, and also give you a chance to ask questions. We're actually going to use the Zoom poll methodology during this presentation. We've got a couple of Zoom polls. And what will happen is very shortly, the question will pop up on your screen. And if you could just click the answer, and then we'll collate those. So here comes our first Zoom poll question for you. So, do you feel anxiety or stress due to the current coronavirus situation? So don't overthink this, please. Just a quick yes or no, and we'll have a quick look in a minute at the results that come through. All right, shall we see if we can pull up the responses? Let's see where we go. Okay, so about just over 2/3 yes and a third no. And we've done this presentation a number of times now, and that's quite normal for the responses we're getting. So clearly we are talking about the right subject today, because 2/3 of us are feeling to some extent some anxiety or stress due to the current situation. So hopefully those who have answered yes to that will get some benefit out of this, and even those who've answered no, hopefully I'm sure you're dealing with people who have the situation of anxiety and stress and can support. So we're going to look at the levels of prevention, and obviously we're basing this a lot on the science of public health and infectious disease, and what that tells us there are 3 levels of prevention. So the primary prevention is, of course, keeping people healthy, and that's what we want to do in our general lives. And before coronavirus came along, of course, primary prevention of keeping people safe and healthy at work was always there. We then have secondary prevention. So when people do start to show indications of a problem, we need to start to mitigate that effect, don't we? And again, this is true in all areas of workplace health and safety, but particularly true at the moment. And then the tertiary, or the third prevention. So when people are ill and people become ill, and provide support. So in thinking about these 3 levels, what do they mean for us? Well, obviously, as we said, our primary role as IOSH practitioners is to keep ourselves and others healthy, and that's our primary prevention. But as we've seen, under the stresses of the current situation, we really do need to think about how to mitigate those issues as they become indications of a problem, and then certainly when they become in that tertiary level of problem, what strategies do we have to make to really help people through the challenges that they have. Hopefully you're aware that IOSH has 6 current priorities, and one of those is very clearly well-being, which is physical and mental health. So obviously when IOSH, when we developed our 6 priorities, coronavirus was not something that we were specifically thinking of, but clearly now more than ever, this is one of the priorities that absolutely matters to us. So we've looked at some of the research, and one of the prominent researchers in the area of stress at work is a gentleman called Robert Karasek from the University of Massachusetts in the USA. And the Karasek model demonstrates that stress can be manifested by 3 different variables, which you can see we've represented on the slider bar there on your screen. So we've got an individual's perception of demand, we've got an individual's perception of control, and your perception of social support. So the idea being that these 3 variables can move up and down, as you see on the slider bar. So when the demand button is seen as high, but the control is seen to be low, and also there's a lack of social support, that's when people become stressed, and we have frequent negative health aspects. So if you can think about moving up that slider bar on the right, and it goes up to the high, but the control and social support stay low, and that's really when the problems start to arise. And although Karasek's model focuses on workplace stress, it's absolutely applicable to the current coronavirus pandemic, isn't it? So fearing the outcomes of the virus translates into a perception of a high demand for good health. And everyone has a different level of anxiety around the coronavirus and what it means to them. But as we've already seen, over 2/3 of us on this call already have said to some extent that fear and that anxiety is significant. And what the research also shows is that most people feel they're not able to control the outcome. So we've got demand high, control low. And then specifically with this pandemic, where we're seeing a great degree of isolation, that very much translates into a lack of social support. So we can see how those sliders have gone up on demand in the current pandemic, and the control and social support are still down at low. And as Karasek said, that's where anxiety and then stress becomes an issue. Here's a slide which hopefully everyone is familiar with, and it's one that we deal with every day of our lives. So the severity and likelihood risk matrix. And so we can again apply that to the current situation. So if you think about the risk rating, so COVID-19 clearly is a high risk. So we already are moving into that stage where saying in the current coronavirus pandemic, because what we've seen with those slider buttons, we have a high risk. So it's one that does need to be managed. So now I'm going to hand over to John, who will take us through the next part of the presentation.
Great, thanks very much, Tim. Okay, so in the year 2001, that marked the ILO, the International Labour Organisation's entry into the area of stress at work. In its flagship programme, SOLVE, the ILO described a model by which stress could trigger one or more negative outcomes, or any or all of negative outcomes could trigger stress. So they're all interlinked. And this leads to a negative spiral or a negative synergistic effect. So, for example, as Tim just outlined, the stress associated with COVID-19 generated, as mentioned before, through this high demand, a lack of control and a lack of social support. This may put an individual into a frame of mind that precipitates a lack of sleep and or substance abuse, which in turn could lead to psychological or physical violence. Now, just yesterday, the United Nations came out to the press and said that there's a silent pandemic hiding just behind COVID-19, and that's the appalling rise we've seen in domestic violence cases right across the world, where they estimate there's been a 20% increase since coronavirus occurred. So whilst we've been in lockdown, families have been locked down with abusive people in their household there. And middle of April this year in London, the Met Police had arrested an additional 4,000 people for domestic abuse cases, and that was by the middle of April. So now we're here nearly the middle of June. That number could have doubled again. So it really is a significant challenge on top of the already difficult situation we're in with COVID. And of course, we're seeing acts of discrimination and also acts of attacks on those people out there who are there to help and care for us. Attacks on healthcare workers, for example. So here are some examples on the next slide of outcomes that can be a source or a result of other outcomes. And there's stress, addictive behaviours, psychological and physical violence, inadequate sleep, inadequate nutrition. We've got social insecurity, financial insecurity, and leading back around to violence. And these are all interlinked. Now, I think at this point, we've got another poll coming up, haven't we, Tim? Yeah, so in your current situation, how many of these outcomes that you just saw on the previous screen, and they'll come up in the poll, do you feel you are experiencing? There we go. So 7% of people on this webinar have had none of those outcomes. The highest rate in there is 30% of people have had at least 2. And we've had 10% who've experienced more than 4 of these. So more than half of what's currently on the screen there. That's really interesting. And again, thank you for being open and honest in your response there. Okay, so a recent communication from the World Health Organization, the WHO, suggested that constant news reports about the current situation can and does lead to feeling of anxiety and distress. The WHO suggests to seek updates and practical guidance at specific times during the day from health professionals and the WHO website, and avoid listening to or following rumours that make you feel uncomfortable. Social media is full of all sorts of great useful information. It's also a vehicle, of course, for fake news and other information to be spreading. There's other actions, of course, we can take to break this chain of causality. Now, the WHO proposes 7 important roles of the occupational safety and health professionals during the COVID-19 pandemic. Related to the presentation we're talking about today, these are assessing risks, as Tim outlined earlier, providing risk communication and engagement of workers, otherwise known as psychosocial support, and collaborating with community or public health authorities. The IOSH Head of Health and Safety in a recent webinar suggested that, on a personal level, we as IOSH professionals need to focus on ourselves and others by looking after and listening to our own mental and physical health and well-being, looking after our own safety and health, maintaining our work-life balance. Now, I don't know about you, but I've been working from home since early March when lockdown applied. And it's been a challenge. I look at my diary and it can be back-to-back half-an-hour slots of Zoom or Skype or MS Teams meetings. There's phone calls interspersing that. It's become quite a challenge to try and separate off actually that work-life balance. In a conventional role where perhaps you leave the house at a set time, return back at a set time, now work and life is all kind of merging into one. Keeping up to date, avoiding misinformation and fake news, and also talking about how we are feeling. Talk to people, talk to your family, talk to your circle of friends that you've got, which again can be a very positive use of social media. And certainly here in the UK, we had a government change in the lockdown rules, and we've now got social bubbles. So if two families or a single person with children or a single person on their own can now meet up with other members of the family. That's great. That's brilliant, because that now on the news yesterday, I heard a lady say she's not actually touched a human for over 3 months. And just that simple thing of being able to cuddle her granddaughter or give her own daughter a hug. These are huge, huge things that we take for granted on a day-by-day basis, but it's only since COVID has come into being that we've suddenly realised just how much we miss these things. So your well-being is important. It's absolutely crucial in caring for yourself and for others. If you feel you're losing control and overwhelmed by events, then make sure you seek support. Social support from family and friends may help. You can also call a psychological or social counsellor for assistance, or through work if you've got access to an EAP, an employee assistance program, where there's usually confidential free advice you can call and seek that help. We have an information sheet available that summarises some of the key points of this presentation that you'll be able to download and distribute to members, colleagues, family and friends. And up on the next slide, you've got some additional sources of information. Now, this webinar has also been recorded, so post-event you'll be able to get access to that. I'm sure that's been made available up on the events page, the same place where you reserved your space on this webinar and you found the login details. So that's it for the main part of the presentation. Hopefully you found that beneficial and useful. We're now going to move over to the chat and the Q&A. So if anyone's got any questions at all you'd like to ask on this presentation, or anything else you'd like to ask of myself and Tim as Vice Presidents, and again, a big thank you to all of you for taking the time to dial into this webinar. It's also great to see some of our council colleagues here on this call. We have the PT9, which is the presidential team of 9 people, 6 Vice Presidents, Andrew as President, Vincent, our past President, and also Jimmy Quinn, our immediate next President-elect. But they are supported by 36 extremely hardworking and passionate council members, and I can see at least a few here on today's meeting, including Kieran Delaney. Again, just to reinforce Andrew's message earlier on, I really would strongly encourage all of you to apply for council. It really is a fantastic role. We can really get involved in supporting members and also being able to shape the future of the profession. We've got Work 2022, so if you are successful onto council now, you'll have a 3-year term. You'll be playing a crucial role in shaping the next 5-year strategy. So it's a great opportunity. So we'll open it up to any questions and discussions or anything else that you'd like to ask. So Tim, what have we got on the questions so far?
Yeah, thanks, John. We've got plenty of questions coming in, so we'll pick some out. Please don't be offended if we don't get around to your question. There's no hierarchy on these questions. I'm just picking a few out. The first, we've got one here from James, which perhaps I'll speak about. And James asks, what can IOSH do to put a positive message out to the public to demonstrate that OSH professionals are supporting the UK and other countries and not hindering that's often incorrectly portrayed in the media? Now, I think, I've deliberately picked this question because what I've found personally in speaking to a huge number of other OSH professionals is, I would say that the perception and the role of the OSH professional has never been greater than now. In fact, in my organisation, I've had very senior people in the organisation who probably wouldn't ever have really thought about health and safety, or even knew who I was, coming to me and my team and asking me, how do we keep people safe at the moment? I've also heard the phrase used so many times by my organisation in my day job and others, that safety is our #1 priority. Now that's fantastic, isn't it, to hear, and it's something that we've always wanted every organisation to say. I do wonder that hopefully when the pandemic has waned, that those people who've been saying that continue to say that for the future. So I think for us as OSH professionals, here's our opportunity. We've got airspace now. People are actually listening to us. Here's our opportunity to put that positive message out. And certainly IOSH have been doing a huge amount of work to share the messages around a health and safety workplace during COVID-19. And there's a huge amount of resources on the IOSH website. We shared the link with you earlier. So please go there and use that. We're doing a lot of posting in social media. So it's your opportunity to tag those messages. And we've also been successful more now than ever in getting slots in the media as well. So on national television, radio. So it's great that we're doing that. I really hope that we're able to maintain that visibility, and all of you are able to build on that going forward and showing what a great role that the OSH professional plays.
Great, thanks, Tim. Thanks ever so much for everybody putting in questions. There's so many here to get through. One great one here from Claire. Thank you, Claire. Traditionally, H&S has always been capital S, small h. We've already seen HSE focusing more on health. In the future, how much emphasis do you feel health will get for the profession? You're absolutely right there, Claire. In 1802, the UK Parliament was the first parliament in the land in the world to introduce health and safety legislation. And since Health and Safety Work Act 1974, certainly here from UK perspective, industry has changed beyond recognition. And for all these years, we've whispered health and shouted safety. And when we look at the figures in the UK, for example, 147 employees dying of a work-related accident last year in the workplace. When we look globally, we've got 2,780,000 people in 2019 died because of their job. That's 2.8 million people. And the vast majority of those, it is health-related matters that has caused the negative effect there. It's things like asbestos, it's things like other occupational cancers. So absolutely, health really does need a key consideration. And certainly for the last 5 or 6 years, I've seen that being a key priority for organisations looking at employee health, the wellbeing side particularly. But at the same time, also not losing sight of the day-to-day safety aspects that we also need to manage. And bringing it back to COVID, that's one of my concerns. Actually, organisations out there are spending so much time and effort focusing down on the COVID risk, quite rightly, that actually are they losing sight of some of the other business as usual things that we all used to deal with up until January, February time. If you look, for example, the irony of people returning back to work, they've got all the controls in place for COVID, then people in that workplace come down with cold and flu type symptoms, but actually it's got nothing to do with COVID. It's now Legionnaire's disease they've contracted because the employer or the building management team forgot to do all the routine flushing and all the day-to-day stuff they should have done in terms of the water hygiene. So we must make sure we don't lose sight of all the things that we've got there. And Tim, while I've got the questions open here, I'll take another one if that's okay. Kay writes, what do you foresee as one of the primary challenges for a workforce that will be working from home on a permanent basis? Again, great question there, Kay. I think for home workers, that falls into one of a number of different roles. They could be assembling products at home, they could be involved in soldering or all sorts of things, they could be home bakers. But I suspect what you're referring to there are people who are working on computers. Ordinarily they'd be working in their office, now they are working from home while workplaces remain closed with COVID. I think the key thing there is being pragmatic and practical. Again, sorry to refer back to the UK. I know we've got a global audience of people here looking and taking part in this webinar, but within the UK, the Health and Safety Executive, our regulator, they have been very pragmatic and said, look, if you are temporarily working from home, do not expect your employer to complete a home workers risk assessment. Do not expect your employer to provide you with desks and chairs and other equipment, unless there's a very specific reason for doing so. So if you've got somebody, for example, who does require an office chair because they have a clinical need for it, then of course employers should be looking to address that. I think the challenge is going to be, at what point does temporary stop being temporary and become permanent? And maybe that'll be dictated to both through guidance. Maybe that'll have to be OSH practitioners like ourselves making a pragmatic and practical approach on that. I think one thing's for sure is that the office landscape is going to change probably forevermore. It's certainly not the death of the office as we know it, but things are going to change. I think the days when you've got major organisations with hundreds or thousands of people on floor plates in city centres around the world may well change, as organisations have now realised that people can be productive and work effectively at home. But great question, Kay. Thank you.
Thanks, John. I've been drawn straight to the next question on the list from Sakib, which is a great question, going back to mental well-being. So what methods can be used to assess mental health and well-being at an organizational level? Well, I think the answer is there. It can be. There's multiple methods, and they can go from the simplest through to the complex and well-designed surveys that organisations can provide. But if we just think about the Zoom poll we just had, so we had eight characteristics there, and we just very quickly asked all of you on here to give us an idea of how you felt and what are those attributes that you were feeling. So I guess as simple as that. I mean, ask your workforce in a simple survey, just are they feeling any of these anxieties and any of these characteristics? And you'll get a very quick, I guess, what we call a pulse survey of the levels of anxiety amongst the workforce in your organization. And just getting that kind of temperature check is really good, because then you can look at the specifics and talk to other people in your organization saying we need to focus particularly, perhaps it's on lack of sleep. If people are saying, well, the biggest thing we've got is lack of sleep, what can we do as an organization, particularly with people working from home and having to work from home with a partner who's also working from home and homeschooling 2 or 3 children? Clearly that pressure is going to be huge. So what can we as an organization do to first of all recognize this and then do something about it? And the one thing I've really taken from this is that if people feel they're being listened to, then they're very receptive to measures to support them. I think the worst thing we can do is not show that we're listening to our workforce. And we, again, as IOSH professionals, know that that's absolutely key, isn't it, in everything we do. We can't do our job if we're not listening to our people. So great question. So thanks for that.
Thanks, Tim. Just looking at a question here from Neil. Neil writes, what is your views on safety professionals providing safety support virtually, i.e. carrying out safety audits and inspections by Zoom, etc.? Other platforms, of course, exist, which will show we are leading by example and following the guidance we are asking all to follow. Great question, Neil. Again, where challenges present themselves, then so do opportunities and innovation. With my day job hat on, we are audited and certified by BSI to ISO 45001. I work for a global business with offices from Fiji through to San Francisco, and BSI have adapted by carrying out virtual audits. Clearly, our offices are closed in nations where they need to be, so things like checking fire escape routes and all the physical things that get checked in the premise, that clearly can't happen because there's no one there to actually facilitate that. But in terms of looking through our management arrangements, plans and documentation, etc., facilitating interviews with staff and our leadership teams, etc., then absolutely, yeah, we can do that through Zoom and other platforms. As safety professionals, we can also carry out a range of other activities. So a question came up earlier on, or a comment about virtual training. Absolutely, yeah, the training providers have been quick to move into that, and certainly training can be delivered very effectively via platforms such as we are here with Zoom. To a degree, I think obviously practical-based training is going to be difficult. Trying to carry out CPR training is going to be somewhat problematic via Zoom, or other practical-based training such as forklift trucks or plant and equipment. But I think wherever possible, yeah, we'll use technology to try and adapt and overcome as best as we can.
Thanks, John. I'm going to go back into the field of mental health. Is one that's really interested in it. It's actually from an anonymous questionnaire, but I'm quite comfortable with that. So, the question is about the role of the mental health first aider, and has that changed, or will that change during the pandemic? I think I'll just expand that to during the pandemic and afterwards. Again, I think this is the opportunity to really promote the interventions and the support that we as IOSH professionals can provide. So again, mental health first aiders or similar interventions to support the mental health of our workforce have been around for a long time. But now's a really good opportunity to shine the spotlight on that. And I think as we do that, and we really share and promote the support that we as professionals can give to supporting our people around mental health, then that will grow in its awareness, it will grow in people understanding what it's about, and then hopefully post-pandemic we'll have an even greater opportunity to build on that. And I think quite often the challenge, and let's be honest, the challenge is around resourcing these types of intervention. And I'm hoping that the pandemic has jogged perhaps the people who in organizations control the purse strings to see that these kind of investments are absolutely worthwhile, and that the return on investment of putting in place mental health interventions and others is absolutely beneficial. And hopefully we can use the kinds of surveys we talked about earlier, maybe before and after, to really demonstrate to organizations of the benefit of that. So thanks for raising that. It's a really good question.
Yeah, great. Let's just have a look through some other questions that we have here. Can you see anything else there, Tim, that we can talk through? As a comment here from Chris. Thanks, Chris. Hi, Jonathan. Would you be able to provide the reference to the CARSEC model referred to today? Yes, we can. Yeah. So there'll be some notes following the webinar that we can circulate, and in there you've got the reference. So yes, we can certainly share that with you. Chris, thanks for asking.
John, I might pick up the question from Tim, because it's one I'm absolutely working on at the moment. So it's talking about the term unlocking, and I think many governments around the world are starting to look at, well, we'll call it unlocking, or relaxing some of the restrictions on us, and the relevant controls that are in place. So how can IOSH and OSH professionals influence that debate on planning potentially for a second wave that may come if we are relaxing some of those restrictions? So that's one that's absolutely occupying my day job at the moment, as I'm sure it is many people. And I think it's about us being really strong and clear about the advice that we provide. So there's two things I want to say there. One is, OSH professionals, we can talk very much around risk, and we talked a little bit earlier, didn't we, about risk, and whether you people have slightly different interpretations of where COVID sits on the risk matrix. The point is, we are the best people to advise on risk. So we know that as you relax controls, the risk can potentially go up. And there's a kind of point, isn't there, where the relaxation of controls goes too far, and then we are potentially in the line of second waves. I think the second point I really want to get across as well is for us as OSH professionals to understand that we don't know everything. And I'm certainly not an expert in epidemiology or infectious disease. So when people come to us for advice on this, do we have access to expert advice to support that? And I know lots of organizations do, and they have access to expert medical advisors. But also, we gave you some links earlier, didn't we, around the really great websites that are around. We've got IOSH, which is pulling together a lot of the information from organizations such as the World Health Organization, the European Centre for Disease Control, the US Centre for Disease Control, and many other public authorities that have this advice. So I think let's make sure that we look at that advice, and we provide our risk-based advice to our organisations as they start to look at relaxing the controls. And the other thing, and it came up in a meeting I had this morning in my organisation, and the question is, and I don't necessarily have an answer, but the question is, just because the government relaxes some of the legal requirements around this, does that mean that an organisation that should therefore relax their internal controls as well? And an example would be, here in the UK, there's a debate now around relaxing the 2 metre social distancing requirement to 1 metre. And does that mean that an organisation automatically should go ahead and start going for 1 metre social distancing in their workplaces, and all of those stickers we've been helping put on the floor and on the walls? Should we start making those 1 metre? I say I don't have an answer to that, but I think we need to be careful and look at the risk of doing that, and really see if it is necessary. Why can't we say, no, we're looking for best practice at the moment. Let's stick with 2 metres for the moment, because the worst thing to happen, of course, as Tim, you allude to there, is that we then internally as an organisation relax our controls, we get the second peak, and then we have to put those controls back in again. So this is where we come into our own as OSH professionals and use our risk-based approach. So I really like that question.
Yeah, great. Thank you, Tim. I think we've got time for probably one more question. Question here from Avunk, who asks, do you see merit in getting raw data from EAPs, that's employee assistance programs, which is a point I made earlier on in the presentation, when it comes to employee issues and trends that may be impossible with the privacy and confidentiality rules? Again, good question. So on a monthly basis, I get a report from our EAP provider at my workplace, and it is utterly, completely, totally confidential. There's nothing in there in any way, shape or form that would be identifiable across any of the different splits of the data. But what that does do is show us the usage. It shows us the people that have engaged with the various different forms. So is it a phone call? Is it an email that people have raised queries? It also then breaks it down by the topic and the issues that people are raising with the EAP. And some of those things in there could be work related. Some of them are entirely unrelated to work. We provide, there's advice helplines there for family matters or all sorts of different bits and pieces. But yes, it's certainly useful to have a look at that. I'd imagine if you've got an EAP, then somebody in your business is getting hold of that information, probably in HR. And obviously, yeah, as part of ongoing learning, we can look at that and see if there's anything there that's work related. And if it is, then back to Tim's point about taking a risk-based approach, we can look at what we can do to help and support. A great question. Thank you.
Thanks, John. And I am absolutely conscious, both John and I, that we've had so many questions and we haven't been able to answer anywhere near all of them. So apologies if your question didn't get answered, but hopefully you found the presentation today really helpful. Again, as we say, we've got all of the information available to you, particularly on the IOSH website, which is probably a really good first place to go. And then that can point you out into other directions. So all it remains is for John and I to say thank you so much for joining. We hope you found this a useful session. Please keep up the conversations. Please also really benefit from the exposure we as OSH professionals are getting, and let's celebrate the role we play. We've had bad press in the past, but now's a real opportunity for us to show that we are leading in how we support organisations and workers manage this. Anything you want to say as well, John, to finish?
Just to echo those thoughts, Tim. And again, council elections, please do take the time to read all about it. It'd be absolutely brilliant to welcome 12 of you on this webinar as the new intake of council members in a few weeks' time. So if you are interested, please do find out the information. It's on the IOSH website. And if you've got any questions or you'd like to find out more about that particular role, please don't hesitate to get in touch with me. You've seen Kieran also post on the Q&A thread his contact details. If you just want to find out more about the role or discuss any aspect of it, please don't hesitate to get in touch. Thank you all very much for your time. It's great. We've had over 450 participants. Thank you for taking the time and joining the webinar. Thank you.